Welcome to Healing Words, brought to you by the Center for Humanities and Medicine at Mayo Clinic. I'm your host, Jacquelyn Fletcher. Research shows that writing can be a powerful healing tool to use while you're staying with us. During today's show, we'll be sharing writing exercises for you to do, and I urge you to consider trying them. As a founding faculty member of the Creative Writing at the Bedside program here at Mayo in Rochester, I'm struck again and again by the power writing has to help people face and process challenging emotions. Our guest today, Dr. Danielle Ofri, has courageously written about her own fears. Dr. Ofri is the author of multiple books, including her latest, What Doctors Feel: How Emotions Affect the Practice of Medicine. She's co-founder and editor-in-chief of the Bellevue Literary Review, and she's a regular contributor to the New York Times. She practices medicine at Bellevue Hospital in New York, and she's the associate professor of medicine at NYU School of Medicine. Dr. Ofri, thank you so much for being here today. I have to first, before we get started, I have to say thank you.
Thank you. It's a pleasure to be here.
I'm just beyond thrilled because you are a doctor who actually writes about things that very few doctors write about, speak about. You write about your fears, your doubts, your love of patients. So this is incredible. I'm so happy to have you here.
Thank you. It's always an interesting journey. I think when we write, it's a chance to reflect more deeply. In our day-to-day interaction, life moves so quickly. There's no time to pause and contemplate, what did that just mean to me? How did we connect? And writing is that moment to step back and think a little bit.
Yeah, isn't that true? Isn't that true? And that really helps you experience your life, really, in a way.
Experience and to dig a little bit deeper, to give those interactions their due.
I love that. So you didn't just start out writing about your experiences as a doctor. What was it that brought you into that? How did you start writing?
It certainly was not in the plans. You know, I went straight through as an MD, Ph.D. student, so I spent a lot of years in the laboratory. I was kind of headed for a clinical research type career. By the time I finished training, and I trained during the height of the AIDS epidemic in New York City, which was quite a dismal time in many ways to practice. It was very difficult, a lot of death, a lot of dying of young people. And I was quite exhausted by the end of the line, and I really just wanted some time away. And so I took about 1.5 years to travel. I did some temp work as a doctor to earn some money, and then traveled for as long as the money would last. And it was during those times of travel that I started writing a bit about what took place in residency. I was so aware that these were unique, intense experiences that I should be bearing witness to, I should be documenting, but there wasn't time, and I think it was too close to the emotional bone at the moment. But once I could step away from the clinical fray, I began to write these stories, not with any intention of a book or publishing, but just to relive and revisit those times. When I came back later as a faculty member, it was an economic crisis, kind of like now. There was a hiring freeze. And when the freeze unfroze, there was only a 3-day-a-week spot opened in the medical center, which I'd never considered, but I had student loans, so I took it. And on those days off, I picked up a writing brochure off the street and began taking a writing class. And that's when I started to develop writing on those 2 days that I wasn't in the hospital.
Oh, that's fabulous. I love that. So you have been trained in the craft of writing. That's great.
It was a wonderful experience. And when I had the option to go full time, I thought long and hard. And I realized that the one thing I wanted was what money couldn't buy, and that was time. And I turned down a full-time offer to keep those 2 days, which to this day I still have, and those are still my writing days.
You've written in your last book about your fear for your patients drove you to writing. Can you talk a little bit about that?
Sure. One patient in particular comes to mind, a young woman in her mid-30s. Her name was Julia, and she needed a heart transplant. But because she was an undocumented immigrant, she wasn't eligible for the transplant list. So the decade we spent together was so filled with fear for her life. And I didn't really have a way of expressing that. I couldn't tell her about my fears. I was there to help her with her fears. And so for me, I turned to writing about her where I could just reveal the deepest, darkest fears that I didn't want to share. I didn't want to burden her with my own fears. And so I found that going back and back to her story gave me a place to face my own fears.
Well, and one of the scenes from the book where she passes away, and in her final days, you sit beside her bedside, and you tell her her own story.
I was traveling and giving a lecture, and when I got word that she was on life support, and so when I came back, I went right to the hospital. I still had my suitcase with me, and of course, I had my book with me, which I wouldn't normally have, and it was so hard to communicate. It is so hard to communicate with someone who's unresponsive, and you can't really have a conversation. I realized the only thing I had with me was her story. I read her from beginning to end, all of her story that I had written down, and we kind of ended at the end of the story.
I loved that part so much because it shows how storytelling not only helps you, really work through your fears and face things that you're working through as an individual, but it also honors other people. And you talk a lot about that too in your book, that you have used writing to honor other people. And I was wondering, you then had the courage not only to sit down, to go to a writing class and to sit down and actually start writing, but then you had the courage to publish your words. And that's a whole another level of courageousness that takes. And I would love to know how you got there, how you made that decision.
Well, it wasn't a planned one, I would say, but I was working with a writing teacher on these stories. And one day she said, I missed my subway stop reading your story. It's time for you to get these stories together and try and get them into a book. And that helped me get the courage for that. But I remember when the New England Journal of Medicine, which is a fairly ivory-towered medical journal, decided to start publishing more creative writing in their perspective section. And I was honored to write a piece for the very first issue that did that. And it was about a patient of mine who passed away in the hospital, a Holocaust survivor, and how that really moved me. And it was a very nerve-wracking experience to put myself out there in this very staid medical journal. Because it's, once a patient begins talking to you or is with you, you're now a character in their story. You are part of their story. Whether you buy into this or not, you are part of the story. And so when you share that story, it's both the patient and it's you.
You talk a lot about, I love that, because you talk a lot about empathy in your book and how doctors are, part of writing can help develop empathy. And we talk a lot about that on this show, how writing really, helps produce empathy in people because we can put ourselves in other people's shoes. And I love that, part of what your job is storytelling. The doctor has to listen to the story of the patient. And you mentioned a doctor, I think it was Spencer in your book, who was one of your great teachers about how to listen to patients. Can you talk a little bit about what he taught you?
Frank Spencer was the legendary chief of cardiovascular surgery at NYU in Bellevue. And he was the guy from Texas with an outsized, fearful personality. I mean, people quaked in their boots when Dr. Spencer came by. He really scared the daylights out of all the faculty and doctors. But patients loved him. They worshipped him. And I never quite he was such a fearsome guy. But in the beginning of medical school, 3 of us were ushered into his office to learn about talking to patients. And the first thing he did was bring up the stool to the bedside, and he wheeled it down to the very lowest setting. And he said, you always sit below the patient because they're in charge. You don't hover over them. They're the ones who run this show, and you sit below them. And I thought, if the chief of CV surgery, Dr. Spencer himself, can humble himself to sit below the patient and let the patient be in charge, well, gosh, I can do that too.
Yeah, that's wonderful. Oh, well, and that leads to the next story in your book that I want to talk about, which is you were working at Bellevue and we're working with a heroin addict who was in, and you had a bunch of students, interns, right? Interns that
students,
you were
residents,
teaching?
the whole gang.
Okay, that you were teaching. And talk a little bit about what you did there.
Well, one of the things I like to do the first day that I pick up a new team, I ask the team, who's the worst patient on the service? Because, there's always a worst. There's the difficult patient, the one who's refusing treatment, who wants to leave against medical advice. And although doctors aren't supposed to talk about the worst patient, there's always one. And let's go talk to that patient. And this guy was clearly the worst patient. He was, I think it was his 57th admission for a heroin overdose, the kind of patient that's really hard for doctors to empathize with. His affliction seems so self-inflicted. He just goes back out and does drugs. Nothing we can do helps him, and doctors really have a hard time mustering empathy. So we went to his room, and at first it went disastrously. The patient just grunted one-word answers. There was nothing we could connect on. I could feel the team shuffling and getting impatient, and I thought, boy, this is going to go down bad. And then a thought dawned on me. I asked him, I said, we doctors, we're present when patients are healthy and we see them when we're sick, but we rarely see them at the precise moment of crossing from sickness to health. Could you tell us the moment you knew you were addicted? And he thought for a minute, he said, I can. There is an exact moment. And he talked about he was driving up the Henry Hudson Parkway in New York City, going to his beloved nephew's birthday party. And all of a sudden, he needed a hit. And more importantly, he wanted that hit. And he said, I could feel my car just turned around, went down. It was like God himself reached down a hand and flicked my car downtown back to my dealer instead of my nephew. It was that moment I knew I was addicted. It was such a precise moment that the room was pin drop silent. And I think for the first time, all of these young students and interns could imagine what it might be like to have inexorable forces pull you toward this. And it wasn't so much that he was a bad or lazy person, but that he was overwhelmed by this. And I don't delude myself that this is going to solve his decades of drug addiction, but it's hard to imagine how we'd get anywhere without a sense of understanding what it must feel like to be overwhelmed by your illness.
Mm-hmm. That story has stuck with me just for weeks after reading it, and I think partly because you just so brilliantly got at the humanity, that was going on in that room that day. You got at his humanity and everyone else's in the room, that everybody was then allowed to connect through storytelling. I mean, it was beautiful, and that's so much of what we talk about too. When we talk to patients and caregivers, that storytelling can really be a way for them to connect while they're here to each other, while something really challenging is going on. So thank you for writing that scene. It was such a beautiful story. I want to talk a little bit, because this is related to empathy. You also write about a study that you had read about that the Rand Corporation did. They studied 20,000 patients and followed them and their doctors for 2 years. And they found that when a doctor felt good, had a positive internal feelings, and were in touch with their feelings, that the medical outcomes for the patients were better. The patients did better. So that's amazing. Can you talk a little bit about that?
It's a fascinating study. We've never actually looked at the doctor's own internal state and the patient's clinical outcomes. We've never really connected those two things together. And they measured how doctors, were feeling about their lives. Were they happy, satisfied, sad, frustrated? How they scored on measures of empathy. And they looked at patients' glucose control, their blood pressure control, cholesterol, clear heart outcomes. And patients for whom doctors scored better on empathy scales and had a better outlook on life did better. And to me, that's fascinating, because the clinical care we like to think is the same. So what is it? And I wonder if doctors who are more comfortable in their own skin somehow exude that to patients who then feel more comfortable and may reveal things they might otherwise not say. They may be honest if they're having trouble with medications. Maybe they feel more comfortable coming in sooner before problems get larger. I'm not sure what it is, but patients somehow respond to that. Maybe those doctors are better listeners and pick up the clues that doctors who are less comfortable in their skin, maybe those doctors miss those clues.
So, how can doctors get more in touch with their feelings? Is writing one of those ways?
Writing is certainly one of those ways. It's not the only one. Mm-hmm. But the message I'm trying to give with my book is that emotions are in the air. And even the most cold-hearted old windbag doctor is as subject to emotions as the most touchy-feely doctor as well. And it's how we choose or choose not to address them that will affect our patients. And so I want doctors to be aware that their emotions are in the encounter. And maybe when you're with the patient is not the time to deal with them, but you have to deal with them at some point. If you don't give your emotions their due, they will come back to haunt us, often at inappropriate and at times in maladaptive ways.
Well, and that's true for everybody in the hospital room watching the show right now.
Absolutely.
Because you're absolutely right. I mean, anytime I think that you really stuff the things that you're going through, and then they're going to come out at some point.
If you think about it, when someone is sick, that's the most vulnerable, powerful time. No doubt there's incredible amounts of emotions churning in that interaction. The patient is sick, frightened, vulnerable. The family might be confused, concerned, overwhelmed. The doctor may be busy and has conflicting demands. So there's all kinds of things happening. And we often just pretend none of that exists. And it's all there. It's not that this should replace the medical care, but then in addition to giving the medical care, we have to recognize that all this is churning, the waves are going around, and we must at some point touch base with them and put them to their best use.
Absolutely. I am so with you on that. And I think that, sometimes there isn't room or time while you're in the hospital to do something like to sit down and write about the experience, but time afterward is just as valuable. And I love that you talk about, this is just a great thing where you talk that patients walk out of the hospital and you might have controlled their disease. They might be cured, they might be healed, they might, feel good, but that they're not necessarily healed. And you have a quote here from Hippocrates that healing is a matter of time, but it is sometimes also a matter of opportunity. And I would love to know, do you see writing as an opportunity for healing?
I do. I think that in the moment-to-moment actions of medical care, it's very hard to address how we're feeling. And that we need to take time and step back. And writing is one of those wonderful ways. One of the things I love about writing is revision. You can't go back and revise your life, but you can go back and revise your writing. So you can go back to the experience and look at it again and change how you want to incorporate it into your memories and how you want to make it fit with your life. So to be able to go back and readdress as many times as you want is a gift that writing offers that real life often doesn't.
Isn't that the truth? I should never complain again about having to revise something. That's great. I love that. Well, on our show, Healing Words, we always ask our guests if they'll give our audience a writing prompt. That's kind of based on the things that we've been talking about today, and I'd love it if you would offer a writing prompt.
Sure. One of the emotions that comes up all the time in medicine is fear. And that is everyone, patients, families, doctors, nurses, and we might not want to think much about our doctors being afraid, but you ask them and they'll tell you when they've been afraid. And part of me thinks we always should be a little bit. We should never lose the fear because what we're doing, people's lives are at stake. So we should have some fear, but sometimes we get overwhelmed. And so I ask people to think about 2 times in which you were afraid. One in which someone stepped in to help you with that fear, and one in which you were left to face that fear alone. And write about those 2 experiences and compare how those experiences played out when you did or did not have assistance.
I'm going to go home and do that one myself. One last thing I'm hoping that you'll do before you go, because I've had the pleasure of reading your work. Your writing is absolutely gorgeous, and I'm hoping that you'll share some of it with our viewers.
I'd be happy to.
Okay, great. Thank you so much.
Thank you. When I think about the times I've been most stressed in my job, I realize that some of the absolute worst moments in my life have occurred at the nexus of work life and family life. In fact, they often take place at the precise moment I'm leaving the hospital to pick up my children. One day, when I was already in my coat, bag packed, hand poised to flick off the light switch, there was the dreaded knock on the door. It was one of my patients with diabetes, worried about a small ulcer on her skin that she thought might be infected. I stood frozen in my tracks, feeling a metal vise click in place around my temples. My patient needed help. Skin infections in diabetics can be life-threatening. But if I stayed with her for the time it took to do a proper evaluation, my children would be left stranded. The vise closed steadily tighter, squeezing from both sides. Every moment I spent with my patient would directly subtract from time with my children. I could have sent her to the emergency room and gone on my way. But I knew that the ER would be a 10-hour ordeal for her. She'd be evaluated by doctors who didn't know her, who'd have to start from scratch to piece together her complicated medical history. They'd probably end up over-ordering tests to compensate. She'd probably spend the night in the ER. I knew that she had a family to tend to, and that she couldn't afford extra medical bills. I couldn't bear to put her through all that. In the end, I did what most physicians do. I tried to do both things and did neither very well. I rushed through an exam with my patient, attempting to accomplish the bare minimum of adequate medical care. And then I rushed to daycare, hoping the minutes would stretch so that I would only be a little bit late. I sprinted the whole way, arriving flustered, sweaty, angry, out of breath, still second-guessing my medical judgment of my patient's infection, arriving to see dejected children and tight-lipped, annoyed teachers who had to delay their return to their own families. The feeling of being caught, of not having control over a situation, of having family life sacrificed, of being damned if you do and damned if you don't, is what makes so many doctors want to quit. The fundamental issue is that our medical system places doctors in impossible situations and thinks nothing of it. It is somehow a given in medicine that doctors are expected to be in two places at once or to do two different things at the same time. This basic premise accounts for much of how the system survives, without much consideration for the effects on the doctors or on their patients. But it doesn't have to be this way. A simple scheduling example illustrates this. For as long as I can remember, medical residents have had a conference at noon, followed by clinic that starts at 1. Noon conference is on the 17th floor of the hospital building. Clinic is on the 2nd floor of the ambulatory care building. The hallway connecting these buildings is the length of 2 city blocks. The elevators in each building are always crammed, especially during lunchtime. In the hospital building in particular, the doors almost always open to reveal a sardined elevator. Typically, you have to wait for 5 or 6 to go by before you can exhale all remaining breath and shoehorn yourself in, becoming more intimate with your fellow hospital staff members than you'd been the night before with your spouse. Alternatively, you could jog down 19 flights of stairs. The 17th floor of the hospital is actually on the 19th floor because the first floor is on the 3rd floor. Don't ask. Conferences are an integral part of education, so to prevent residents from skipping out of noon conference, attendance is taken and absentees disciplined. Residents have a responsibility to their patients, so if the residents arrive late to clinic, they are disciplined for tardiness. But somehow, everyone seemed to manage. The schedule had always been that way, and no one ever thought much about it. We've basically set them up to fail, a new residency program director told me. The minute she described it that way, I saw the situation differently. Although everyone seemed to manage, in fact, no one was managing at all. Residents would try to sneak out of conference a few minutes early in order to get to clinic on time, or they would tiptoe into clinic via the side door so no one would notice when they came in late. They'd cram lunch while flattened in the elevators and then sprint through the halls. We created an impossible situation for them. They were required to attend a conference that finished at 1 p.m. in one place and also be hard at work at 1 p.m. in another place that was a quarter of a mile and 2 elevators away from the first. Short of being beamed down Star Trek style, the resident was doomed to disappoint at one end or the other. So the program director changed clinic to begin at 1:15 for the residents. Not exactly rocket science, but no one had thought of this thing in all the 20 years I'd been at Bellevue. Magically, everyone now seemed to be punctual. If only some of the other challenges of medicine could be solved as simply. Being set up to fail describes much of how modern medicine works, or doesn't work, and why so many doctors feel overwhelmed, frustrated, and eventually disillusioned.
As you've seen today, writing about your feelings or experiences takes courage. Writing can sometimes feel overwhelming to begin if you've never done much of it, but human beings are storytellers. It's how we teach our children. It's how we connect with each other. Take just a few minutes and write about a time in your life when you were courageous. What gave you the strength to be brave? What happened because you acted with courage? How would you teach someone else to find their own courage? Writing is an incredible way to find deeper insight into your own mind and spirit. It can show you things about yourself that you didn't know before. It can give you peace. It can offer healing. Thank you for watching Healing Words. I'm Jacquelyn Fletcher. If you'd like to try some of the exercises you've heard today, you can ask your nurse to contact us and we'll get you a notebook and pen. You can also reach me with any thoughts or suggestions, or arrange to have a writer visit you in your room by using the contact information on the screen. Until next time, be well.